Okay, good morning. And once again, we are here in Decatur, Georgia at 1524 Lavista Drive. And we are continuing with our telecast of analysis on hematologic disorder. And at this time, we are on leukocytosis, which is an elevation in the white blood cell. Now, there are 5 types of leukocytosis that will be dealt with, and these 5 types will be dealt with in case of the 5 different types of white blood cells that will be a focus upon. Before I get into that, I introduce myself once again as Dolphy Gilpin, and I will do a little thing out of order here. We usually leave the treatment for the last, but let me just say before the time's run out that the AMZ5X12MIPCA in IPCA, implicit pharmacologic disorder, pharmacology, the IPCA configuration is significant now in the treatment, and in particular the dosage generic drug and the pharmacochemical application treatment. But as we have also stressed in the other video telecast, that it's in the implicit mode, and we are not sort of making data explicit at this moment for various IP or intellectual property reasons. So we continue with leukocytosis, white blood cells disorder, and we look at first the basophils, an elevation in the basophils called Basophilia, the condition of Basophilia, an elevation in the basophil, which are one of the types of white blood cells. And these basophils now carry heparin and histamine to infection or inflammatory sites, such as psoriasis, rheumatoid arthritis, IBD, irritable bowel disease, and bone marrow disease. So these basophils, in the condition of leukocytosis called basophilia, carry this substance, heparin and histamine, to inflammatory sites. So I'm going through it very quickly. And if there's any doubt about this basophilia, what we could do is a bone marrow test or a genetic test if the condition of basophilia is unclear. So secondly, we have the condition of eosinophilia, in which the eosinophils, which are special white blood cells now, the elevation in these eosinophils leads to the condition of eosinophilia, which is another type of leukocytosis. And there are 2 types of eosinophilia. The eosinophilia of the tissue, an increase in the eosinophils in tissue, and an increase in eosinophils in the blood. So you have blood and tissue eosinophils. And these also to regulate inflammatory sites and help to break down foreign substance, or help to destroy foreign substance that attack the body, like parasites. They help to destroy parasites. Third, we have neutrophils, elevation in the amount of neutrophils, neutrophilia, another type of leukocytosis. And these attack bacterial infections. And neutrophils are found in sites of wounds and injury, where when during the process of healing, you have this white pussy fluid that is under what we call like a scab. So this white pussy fluid contains dead neutrophils, which is a process aiding in the healing of the injury of the site. So neutrophils attack bacterial infections and also aid in the injury. One of the 4 types now would be the monocytes, or monocytosis, which is another form of leukocytosis, elevation in the leukocyte count, and specifically the monocytes, elevation in the monocytes, And what we have is that these white blood cells are the largest in size, and they differentiate into macrophage monocyte cells or dendritic monocyte cells. Now, these macrophages are all-purpose white blood cells. Like they do a comprehensive job in inflammation and they can be found in malaria and tuberculosis infection. And the dendritic cells help to protect the external tissue. Whereas the macrophage are the all-purpose cells, they aid in, say, malaria is one of those infectious diseases that was very destructive back in the time, but they have come to keep it under control. So malaria and tuberculosis, likewise, but there are still cases of tuberculosis here with us today and cases of malaria that is here with us today. So these macrophages are significant in the process of healing in malaria and tuberculosis, or in the detection of malaria and tuberculosis. We have the dendritic cells help to protect the external tissues. And fifth, we have now the lymphocytes. Elevation in the lymphocytes, specialized white blood cells, leads to lymphycytosis, which is another form of leukocytosis. Now these lymphocytes differentiate themselves into our T cells, B cells, and natural killer cells. And all these various types of lymphocytes now have specific function to do with specific abnormalities, disease, and disorders in the body. The T cells, the B cells, and the natural killer cells. For example, some of these will be found in nucleosis, mononucleosis, these lymphocytes, or viral infection in children. And in condition of a lymphoma, what we have is a elevation in the lymphocytes and neutrophils count simultaneously, so that if we have both simultaneous elevation in the lymphocytes and a high lymphocytes count and a low neutrophil count, would be indicative of a lymphoma. So that's basically the 5 types of white blood cells that we deal with in leukocytosis, and each one of them have a special form of leukocytosis, like Basophilia, Eosinophilia, Monocytosis, Lymphocytosis, and Neutrophilia. And that's that. Now there are different treatments for these various different forms of leukocytosis, and like I said in the beginning or the commencement of this brief lecture, that the AMZ5X12 matrix in IPCA, the implicit pharmaceutical configuration is significant now or can be applied in the application treatment of the disorder or leukocytosis and the various 5 differentiated leukocytosis that we have dealt with here, like Basophilia, Eosinophilia, Neutrophilia, Monocytosis, and Lymphocytosis. But as we have stated that due to intellectual property at this time, we have not stressed or expanded on our AMZ5X12 matrix in IPCA for treatment, and specifically drug treatment, generic drug treatment in these various abnormality or malignancy in the body. So we'll just leave it in the implicit mode at this time while we continue to work on it. So next time we will deal with now, we have covered the three major cells, the red blood cells, the white blood cells, and the platelets, and their disorders in elevation and reduction of the micro components in these conditions. So we will deal with now the stem cells in our next presentation. So until our next presentation, we will now sign out from our analysis now of leukocytosis, and in particular the 5 types: Basophilia, Eosinophilia, Neutrophilia, Monocytosis, and Lymphycytosis.